CDC report from Dr. Walensky, an update from Dr. Fauci, and Dr. Ntsh, who will talk about the challenges we are facing to improve health equity in the face of this pandemic. Let's start with Dr. Walensky.
Thank you so much. Good morning. I'm glad to be back to share the latest updates on the state of the pandemic. I'll start with an overview of the data. Overall, while we continue to see decreases in COVID-19 cases and new hospital admissions, deaths also continue to rise. Cases remain at elevated levels, so let's start with the cases. Through January 30th, 25.9 million COVID-19 cases have been reported to the CDC. During the week of January 24th to January 30th, the 7-day average of new cases decreased 14.5% to 149,000 cases per day. The 7-day average of new hospital admissions for patients with COVID-19 during the week of January 23rd to January 29th also decreased by 14.6% to 11,800 admissions per day. However, 85,655 people were hospitalized with COVID-19 on January 29th. Through January 30th, 438,035 deaths have been reported to the CDC. During the week of January 24th to January 30th, the 7-day average of deaths increased 2.4% to 3,146 per day. While the recent decline in cases and hospital admissions are encouraging, they are counterbalanced by the stark reality that in January, we recorded the highest number of COVID-19 deaths in any month since the pandemic began, with over 90,000 deaths recorded in January alone. Next, I want to give you an update on COVID-19 variant surveillance. Variants remain a great concern, and we continue to detect them in the United States, with at least 33 jurisdictions reporting 471 variant cases as of January 31st. 467 of these cases are now B.1.1.7 variants, first detected in the UK, and cases of this variant have now been detected in 32 states. 3 of the cases are the B.1.351 variant, first detected in South Africa. 2 states have reported cases of this variant. This includes 1 confirmed case in Maryland over the weekend and 2 confirmed cases from South Carolina last week. CDC has followed up with Maryland to offer technical assistance, including additional case investigation and laboratory support. CDC is also working with the Health Department of South Carolina to provide laboratory support for local contact tracing activities related to the 2 cases there. Finally, there's also 1 case of the P1 variant, the one first detected in Brazil, which has been confirmed in 1 state, Minnesota. CDC is not currently providing technical assistance in this case, but stands ready to assist if the state requests. CDC has been working on multiple fronts to improve our ability to detect and understand these variants. And the recent rise in number of variants detected in the United States is likely due, at least in part, to our expanded ability to sequence virus samples. Since November, state health departments and other public health agencies have been sending virus samples to CDC for sequencing and further analysis. This system